Our next topic is public health and safety. How do you plan to support public health and safety in Eau Claire? This could include your vision for collaborating with the City County Health Department on community health issues, addressing mental health or substance abuse challenges, and ensuring resources for police, fire, and EMS services, such as the new joint police fire initiatives or the public safety facility needs. And Scott, we'll start with you.
All right, that's a big question too, and there are a lot of pieces to it. I think it's always important to remember that public safety is an essential service that a city has to provide, and so we need to make sure that we're doing everything we can to include that at the level that it needs to be to have health and safety, because without that, you don't want a reputation for being an unsafe community, and you want people to have fast response times. I think one of the things that we can talk about, the collaboration in our community, and all of us kind of want to forget those missing years during COVID, but I think we can, it may not be universally thought about, but I think we can really be proud of our community's response. The COVID task force we had, the involvement of the health department, and working together to keep our businesses as strong as possible, but to keep everybody safe. Sometimes we've actually been recognized as a community in our response to it, and that how we all came together there. So I think we also are fortunate to have a police department and a fire department that are really think about what their purpose is. We've got some challenges coming up. The fire department needs to do some expansion and needs some new fire stations, and that gets into a new fire station. So that gets into the challenges with capital budget and having funds available. And then also we know when all of these issues come together, so homelessness, for instance, oftentimes people who are homeless have substance abuse or mental health problems, and we've had the challenges with closing of facilities. And we're slowly crawling back from that. We've had new providers coming in. We have more coming in. And then the improved leadership, I think, strong leadership from the county health department in working with the rest of the community in attacking some of those issues is a positive step in the right direction. So we have to keep our eye on the ball on all of those things.
Okay, thank you, Scott. And Jeremy, to you again, your thoughts on the public health and safety issues.
Yeah, it's been very important to me to be involved, and even though I've been off of council for a couple of years, I've gotten involved in the Eau Claire Health Alliance, which has really been a great space to bring people together in different organizations, including like WEAU and Sanford Health, and kind of the public sector folks, and I've been chairing like one of the task force is focused on the built environment and how it impacts people's health and helps reduce social isolation. So we've been talking a lot about infrastructure and how that helps address health issues. So a lot of it comes down to like, how do we prevent a lot of problems from happening? And I appreciate the fact that our police department and our fire and EMS are very much focused on that too. It ends up saving lives and money in the long run as well, and makes it more sustainable. And we do need a new fire station to replace the one downtown. And when I first got on council, we were cutting the ribbon on a new fire station over on the northeast side of town, and we expanded one as well on Station 6 on Gulf Road after passing a referendum that the community supported. So I was just meeting with the firefighters, about some of this like a couple months ago too. So being in constant, communication with what the needs are from the staff end of things, and that perspective is important. I too was very, impressed with the way our community handled the pandemic, but there are a lot of other challenges, especially, with the federal level when we have Medicaid and Medicare and SNAP benefits, being reduced by the federal government, and all sorts of other things that may be in the news today that I haven't read yet. Seems like everything changes very quickly. So we need to be able to respond quickly. Thanks.
Thank you, gentlemen.